Is it working? Is it? Okay. So we'll start our seminar from today. So I don't know about the signatures, the attendance, whatever. So if Miguel arrives in time, he'll ask you for your signature for presence or whatever. But if not, you can say that you were here. So today we have the pleasure of having Ignacio here, or Ignacio Prieto. So Ignacio, I have here notes already, know some, but so he is a telecommunication engineering from Carlos III University in Madrid. So he was working on WiMAX at start after graduation, and then he did some voluntary working on Cambodia. I don't know if there was what triggered the rest of this work, but maybe it was. So he was then a researcher in ICAM, Castilla-La Mancha University, and invited lecturer currently University Rey Juan Carlos in Madrid also. So, but the main thing that he brings us here is as project director of EAS, a foundation for, in this case, Latin American, and in this case, what they try to provide is health service, health care in developing countries. So the main work that I think he will show us is regarding providing telecommunications for this telemedicine. He'll describe it. So there has some projects. One he mentioned just at lunch, which is token. Is the 3G that you mentioned is the precursor or the successor of the toucan one, the one with the the bird, and some telecom microscopy that he'll mention. So most of the things he'll describe it in detail on his presentation. So thank you again for coming, and the floor is yours.
Okay, now it's better. Well, I'm here. The title for this lecture or this speech is Innovative Technologies for Health in Developing Countries. Talking about innovative technologies is something tricky, and especially in a university that does some so interesting works in telemedicine, in things related with health. But I'm trying to bring a different perspective, the perspective of applying this kind of technologies, this kind of projects to developing countries, especially to rural areas of developing countries that have quite special characteristics, as we will see. As introduction, ES Foundation is an NGO, a Spanish NGO that was founded like 10 years ago by an NGO, ONGAWA, that comes from Engineers Without Borders and the university, the Polytechnic University of Madrid. And after that, other universities joined it, Universidad Rey Juan Carlos, Universidad del Cauca from Colombia, Catholic University of Peru. So it's an NGO with a background very related with universities, but also with development and with technologies. And what we try to do is to check if the using innovative and sustainable technologies, ICT technologies, we can improve the public health system in rural areas of developing countries. And here I remark some words, because when we say to check, we do a great effort in the research activities. We try to prove that our solutions are working, and it's something that I will also emphasize along this talk. And we also try to find new solutions. We are not trying to replicate things that are working in other parts of the world. We try to find new ways of applying technologies or applying existing solutions, or even developing new solutions for all problems. And we try to work always with public systems, because we think that is the best way to get scalable solutions and also to test the solutions in probably the worst case or the most common scenario. In developing countries, you usually can find small hospital or private hospitals that can work very well because have resources from other NGOs or from special communities, but that are like the exception or rare cases in developing countries. However, the public system is the most common service for the most poor people, for the people with less resources. So we want to focus on that part of the population that have less resources and that needs more solutions for their problems. And along this presentation, I will try to explain why we are focusing on healthcare and some figures about how figures in the world, how is the health in the world. I will also describe a little bit how are rural scenarios, or when I am talking about rural scenarios, what I want to say. And I will explain what kind of some of the innovations we are working with. After a work of more than 10 years, we have a lot of things done, and we are working in several fields. I'm going to explain some of them only, but I will try to give a perspective of other projects we have. Well, obviously, healthcare is something very important for every person in every country and every society. I don't know if you have heard about Sustainable Development Goals. They are based on the old Millennium Development Goals that were established in 2000, trying to establish some objectives, some goals to be achieved in 2015. In 2015, the United Nations created or started a new process to define new objectives, this time until 2030. And these new objectives are the Sustainable Development Goals. The main difference, or some of the difference between both goals, the Millennium Development Goals and the new Sustainable Development Goals, one of the main differences is that the first ones were defined by the panel of experts, and these ones have been defined in a process of where the society has participated, not only the governments, but also NGOs and other actors have taken part in these discussions and have established these new objectives that should be met by 2030. Most of them are similar to the ones established in the Millennium and Development Goals. And for example, health is one of the objectives that is practically the same or has similar objectives. It tries to, or the goal is to reduce the maternal mortality rate and also the newborn mortality rate and the under 5 mortality rate. There you can see the figures. The maternal mortality rates will reach 70. And the objective is also to ensure universal access to health, thinking health like a right, a human right, not only like a service, but it's something that we consider a human right, and therefore should be accessible for everyone everywhere. And also, it's something that was present in the old goals, is the effort to end with the epidemics of HIV, tuberculosis, malaria, etc. All these infectious diseases that are especially prevalent in rural areas of developing countries. For example, or to understand better this scenario, the old goals, the Millennium Development Goals, were established taking as reference the state of the maternal mortality and the under 5 mortality in 1990. And the objective was to reduce these figures to 1/4 in the case of maternal mortality and 1/3 in the case of under 5 mortality. But in 2012, 2013, that objective was not met, obviously, and the new target tries to reduce this rate to, well, you can see there's 70 and 25 respectively. As reference, you can, in Portugal, nowadays or currently, the maternal mortality rate is 6. And we are talking of reducing it to 70. This is the average of the world, or it should be the average of the world. So we are, well, I think it's quite significant, these values. Another significant values are these ones, the number of the cases of maternal mortality in the world and the cases of prenatal mortality in the world. 1 million of the prenatal mortality cases are during the first day of life of the baby. And the maternal mortality rate is 14 times larger in developed countries. That in, is larger in developing countries, 14 times larger than in developed countries. So, well, again, these figures are quite impressive. And most of the maternal cases, or most of the cases without a proper health service are in rural areas of developing countries. That's also an important idea. So we can imagine that maternal mortality is quite related with a lack of a proper healthcare system, especially in rural areas of developing countries. That's one of the conclusions. And there we have a very big problem and a very large number of maternal and newborn deaths. The Sustainable Development Goals also establish other objectives that are related with the aspect that we are going to talk here, that are one side innovation, and they say that, well, innovation is something that we have to try to reinforce and try to focus on affordable and equitable access for all. And we can, in this case, access for infrastructure and services. And they especially talk also about internet, that in our case is also important because we also have worked a lot in providing connectivity to rural areas, connectivity to be used for health purposes, but also for other purposes like education or something similar. And another aspect that is remarked in the Sustainable Development Goals is the need to partnership between different organizations to solve these problems or to face these problems. We are living in very complex societies. The problems we are facing are quite challenging, quite complex, and we need to cooperate between different institutions to solve them. No? And that cooperation, well, the UN suggests to enhance cooperation in terms related with science, technology, and innovation, but also to another important thing is the idea of having reliable data on what is happening. Another problem with all these figures is that we really, some of them may not be so reliable because the information in rural areas is quite poor, not very reliable. Sometimes it's missed or is wrong. So having more accurate information will help to have or to provide better solutions. And that's other of the goals. And we also try to work on this idea in the specific case of health, working with health information systems. Well, this is like establish a little bit the framework where we work, health, trying to use innovative solutions based usually on ICT technologies, and trying to work with local actors, universities, NGOs, governments, to build a partnership that can face these problems. That's our proposal, our ambition. And to better understand all this scenario, we also have to think what means suitable in this context, or ask it in another way, what are the main characteristics of these rural environments? Another important figure, 40% of the world population lives still in rural areas. So again, we are talking about a lot of people and a big problem to be addressed, no? And we have to understand that when we, or at least when we are talking about rural areas, we focus on the more isolated ones. For example, we are talking about the jungle in the Amazon rainforest, or the high mountains in the Andean region, or maybe the deserts. Are a lot of areas in the world that are very isolated from the main cities, from the main roads, from the main services that are available for other citizens. In this sense, in developing countries, the inequality between urban areas and rural areas is very important. And you can find in a lot of countries, you can find the same services that here in Oporto in the urban cities, but however, in the rural areas, you can find almost anything. That's because rural areas are, as I have said, very isolated. They lack of infrastructures, and that means the lack of roads, lack of communications by telephone, by lack of electricity, lack of water. And it means also that it's very expensive to reach that communities, to offer services to that communities. And for example, the professionals, physicians, teachers, etc., they don't want to go to these isolated communities when they when they are not able to make a phone call, they cannot access internet, they cannot improve their career, so they are not willing to go to work to the jungle in Peru. They only go if they have to, if they are. It is mandatory in Peru, for example, to get your physician degree, you have to spend 1 year in some specific points, and some of them are forced to go to these jungle areas, but otherwise they wouldn't go, and they have enough work in other areas of the country, so they can avoid these places. So, and another characteristic of these rural areas is that most of its population is native or indigenous population. Most of the time they have their own language and their own cultural, their own culture. And this also, in some days, is a barrier for someone that doesn't belong to that community to arrive and offer a health services there. If you don't speak the language of the community, it's hard to offer a proper health services there. And another characteristic, or another reason for this situation is the low population density. And this is related with political isolation. The central government don't care too much about this very isolated population. Because, for example, if they spend $1 in the city, they maybe reach 4 citizens. If they spend $1 in the rural isolated areas, maybe they only reach 1 citizen because of the expensive or the lack of infrastructure, the more expensive or the cost of arriving to these areas, and also because there is a very low density, so the population is very spread in these areas. And therefore, the governments prefer to spend the money in more populated areas where they can reach more people with the same amount of money. And this goes for governments, but also for development agencies that prefer to get bigger figures with the same amount of money. Sometimes international agencies prefer to say that they have reached 100 people than only 10 people. And then that logic makes that rural areas are sometimes isolated services and from other possibilities to develop. In these scenarios, usually the communities, the access to the primary health care system is based on a health post where you can find a health technician that usually lives in that community and has been born in that community. So he's not desiring to leave that community, and that's why he's selected as health technician in that area. He is paid by the government, but his training is quite, let's say, basic. So he is the only healthcare provider in that area. He has to face with all kind of problems, all kind of diseases, and he has to sometimes face very even emergencies, because when he detects something that is problematic, he can refer the patient to the doctor. But if it's an emergency, the doctor is usually 4, 5, 10 hours from that point. So referring a pregnant woman that has started with the labor is not feasible in that situation. And doctors are usually in health centers that are, as I have said, usually several hours of travel from the health post. And the health center has facilities, has electricity, has usually more means than the health post, but is far away from most of the communities. So in this kind of structure, the health systems in rural areas of the developing countries usually require a lot of support, has a lot of need of better system for diagnosis, treatment, requires, or the personnel of this health post demands a better access for continuous training, to tools for coordinate emergencies, tools for epidemiological surveillance. And well, we have working on all these aspects on our years of work in developing countries, but well, today I not time to explain the solution we have developed in these areas. I'm going to talk about some specific projects we have worked or we know about that we consider or we can discuss if we are innovative projects. In this kind of area, when we talk about developing countries, when we talk about innovation, everything is open to discussion. There is nothing that is 100% sure, and are very complex scenarios where we can think in something can be good for one point of view, but also usually it has some disadvantages too. So we can discuss about the suitability and if the projects are managed to reach the objectives that we want. The first question will be to ask, well, what we do understand when we talk about innovation, no? And I specify that I'm gonna talk about innovation in developing countries. If probably in other areas, innovation means another thing, but I'm trying to focus or to think or to discuss about innovation for developing countries. Well, I don't know if someone wants to give their opinion about this question, what we can understand by innovation. Yes?
Creating value over some sort of technology.
Well, that's creating, sorry, the value. Yes, creating value as well. Economic value is one option. The economic point of view is important also in development. When we try to apply that to the health system, is not easy to translate and not obvious. There can be translated, or other people that try to translate the health improvements in economic improvements, as there are some relation, obviously, but it's not very obvious how to do it. But
changing the process or improving a process using different kind of technology, Even the process itself can be different. So obtaining an objective with a better performance using different approaches, not necessarily. So different innovation being different and not necessarily just different in an economic sense.
Yes, that's another approach. Try to change the processes. Always trying to improve the results of the system. No? In this case, we can think about health indicators. We can try to improve the process to change is to improve the impact on the health indicators. And well, more or less, there are two of the basic ideas. I don't know if someone wants to add something else, another idea. Well, I have written here one possible definition. This is something that is open to discussion, but well, I will say that is the application of new ideas to improve the products, processes, or other aspects of an institution activities. In this case, we focus on health providers or health systems to better accomplish their goals. No? And here, like three important things, of course, new ideas that most of the times will be based on research and development, and sometimes are only a different way of using all things, no? As we will see. But related with this, and in developing countries, and something that I will try to emphasize later, is that if you do something now in developing countries, you usually have to focus or do a very important effort on training and to make people to appropriate of this new idea. You also, when you talk about application in developing countries, it's obviously a practical work that is usually applied or used in a complex context. So you have also to have this in mind. Also, the solutions are usually not simple, and that complexity usually needs to be faced with different actors working on that area. And an important thing from my point of view is the need for it to be scalable. Well, if you design a solution for a very, very specific environment, well, maybe that's innovation, but for me, it's important that it can be scalable and replicable in other areas, in other countries or regions, because the problems are usually quite common. And so you usually have to adapt a little bit your solution, but the basic idea should be replicable. And also, and a third thing, and I think it's also very important, is to really prove that you have improved something. Because if you change something to improve and you don't demonstrate that you have improved it, then I'm not sure if that's an innovation or it's something changing things randomly without too much criteria. So I think that is important also, and I think that from the university we have to defend and the importance of evaluating the projects and having results, scientific results on what we are doing. And well, to show you some examples of how these ideas can be implemented, well, I am gonna talk about an NGO in Guatemala, Tula Salud, that, for example, Guatemala is a country with very high inequality, and for example, you can see that indigenous population has a mortality rate 3 times greater than a non-indigenous population. Indigenous population is usually in rural areas, and non-indigenous population is usually in urban areas. So again, we have this inequality between urban and rural areas, and in this case, is moreover not only rural-urban, but also between indigenous and non-indigenous people. And I think that is something that we can reflect about or think on it about also. Some other figures about what I'm going to talk about a project that works in a specific department, Alta Verapaz. Although it's in the last year, it has been expanded to other departments, but the results I'm going to show here are from one specific department. And in that department, almost 80% of the population live in rural areas. They are from indigenous community. Almost 50% of the population live in extreme poverty. Extreme poverty means less than $2 per day. And they have a mortality rate, maternal mortality rate of 273, what is very high, similar to other countries in Africa. Inside Latin America is one of the highest mortality rates. And well, the problem in these areas is quite similar to what we have already said for rural scenarios: lack of personnel, lack of proper roads or transport means. And most of the times, the population, the only problem is not only have access to transport, but sometimes if a woman should be referred to a hospital, she refuses because she feels that she must be taking care of their children, and she thinks that no one is gonna do that if she's not there. So there is a gender issue in these communities that is a special problem for women, obviously. So with all this, with the cultural situation in not only in this area but in the world, unfortunately, it also has an impact in these rural scenarios. And maternal mortality is especially high, not only because of technical problems, but sometimes also because a gender issue. In these scenarios, usually the government, the structure in Guatemala for the health system is based on community facilitator, that is someone that has a very basic training and a very basic health kit. That is the first person to talk if you have a problem of a health problem, no? And this person is the one that should refer you to the doctor or to the health post, but it's a person that makes acts as a interface between the people and the community and the health system. The reason for these people or the role of these people is required because first, there is no other health staff in the area, and second, they belong to the community, so they are closer to the people, and the people relies on them. So it's easy for the community, or for the people of the community, to rely on this community facilitator, and at the end go to the doctor. Otherwise, sometimes they prefer to go to the healer and avoids doctors and the scientific health. Healers sometimes can do a very good job for some specific things, but are others that can't be solved with a healer. No, so I don't want to criticize culture, but I think that we have to find points in common, and well, I think that the community facilitator is a good solution, but with a very low training and with very low resources. And that's probably part of the problem. And in this scenario, Tula Salud proposed a very simple idea that was to provide this health facilitator with a health cell phone, with some additional training, and also to use this phone to more applications. No? So with this health phone, the facilitator can talk to a doctor and do some consult his stats with him, so he can decide or he can discuss if he should refer a patient to the health center, or if it is not necessary. And he can also receive a continuous training. He can also send epidemiological and clinical information. He is detecting, for example, a number of pregnancies in his community. He can send information through the phone. So in the health center, they already know that in that community they have a number of pregnant women, a number of cases of malaria, whatever, and they can decide if they should go to that community and take a specific and do a specific action. And also they use this cell phone to do this is like in this picture below. It's not very clear, but they have an amplifier to amplify the sound of the phone, so they can have tele-education through this system now. So they connect, or some of the community, they meet in a point, and they can hear a speech about health promotion or health prevention, or even other issues, because they are using now this system to do projects to face or to work with gender issues. No? So this strategy can be applied to other aspects of their life. But in the beginning, or at the beginning of the project, it was applied to health prevention and promotion. And well, this system was started to work in around 2009. And well, now they have almost 200 community tele-facilitators, and they have done an important number of medical consultations and urgent referrals. And well, what's important about this system is that we have studied the impact on maternal mortality in this area, in the area covered by these tele-facilitators, and we have compared it with the areas that are covered by common facilitators without access to a cell phone and the training and all this innovative project. And we have seen that we have proven that this solution manages to reduce the maternal mortality. And in the intervention group, the reduction is important, whereas in the control group, the maternal mortality keeps high. So, well, the solution is perhaps not very complicated. It's also based in a public-private partnership. To La Salud is an NGO that is, well, private in some way. The health minister also collaborates with this project, and also it includes or have included in the last years the cellular operators to make the tariffs more affordable and to make the project more scalable to other departments of Guatemala. And well, we now could discuss if this solution is or not innovative, because well, we can think that it's very easy to use a cell phone. The cell phone is not an innovative idea, and to use this to call and to get some consultations is maybe not an innovation. Or no, or yes, someone want to give his opinion on this question?
Well, the innovation does not need to be technological, but it can be methodological.
Mm-hmm.
And this healthcare is done differently than what was done before. So yes, from an healthcare perspective, it should be, and in your definition of innovation, I would say it's innovation.
It also depends on the perspective, right? From the perspective of the rural population, it was a technology innovation, right?
Yes.
They didn't do it that way. They did it using a different technology, right? So from that perspective, it's also a technology innovation per se.
Yes. Yes, and taking into account the definition I explained it, or I used it before. Well, it's a new method. It is scalable. It is based on training and on working with the people. It is has been proven that is useful, and that's something that is very important. You can try if you want to look for projects in developing countries that prove its impact on maternal mortality. I have not found. I think I found a small one, but it's really hard to find projects that have proven that they are doing something. And this is not, I think that are very interesting projects on the road, but it's really hard to make all the effort to prove that it's working. And I think that is something that may be also innovative, no? To reach this point.
Just one question regarding the data. What was the whole department? That was a
Yes, that was the mean of the whole department. We use it as a reference. You have the control group, the intervention group, and the whole department. No? So we can see that the mean of the department is or the trend in the mean of the department is similar to the control group. However, the intervention group changed the shape of the curve. No? So that's why we use that line as reference, let's say.
And the regions were similar before.
Yes, it was the same region. It was the same department with similar telefacilitators. So the main difference was that one has the cell phone and another one no. It's hard to find exactly the same communities, but I think that we have done this is a published article, and I think that is quite consistent. Well, we could go a step further and try to analyze the causes of maternal mortality. And well, this is, for example, the usual, or in developing countries, the most common causes are these ones here. And well, seeing this list, hemorrhage, hypertension, infections, abortions, suspected labor, intercurrent diseases, we can think, well, how could they be detected ahead of time? Because most of the times the problem is that if you have an obstructed labor, if you find it during the labor, it's hard to solve it because you are far away from the hospital, far away from a doctor. So it's difficult to get to a good solution. Sometimes the baby dies, and sometimes even the mother dies, or she can get also some disabilities from that problem. No, so the part of the problem is how we can detect this on time. Here in urban area, how we detect these problems.
Exams prior to
exams that are basically ultrasounds, scans, blood exams, and urine exams. The problem with this exam is first, you need an ultrasound system. Second, you need someone capable of doing this ultrasound. And for the case of the blood test, you usually need a cold chain or a laboratory with electricity, with reactives, with a lot of things that are not available in rural areas of developing countries. So the prenatal checkups in these areas are based only in palpative checkup, like here. And if you have to transfer the pregnant woman to another place, you sometimes have to do like this, with a chair in the back of someone, and that's the way to get a pregnant woman out of the community. So I think that is a good example of the problem. No? If this is an emergency, well, it's a very bad emergency. Well, so the solution that we proposed in this scenario was to use a portable ultrasound system. And portable means this. This is an ultrasound probe that can be connected to the USB port of a laptop, like this one. And you can carry both things wherever you want. And you can operate with the battery of the laptop. And you can do very basic ultrasonography. But a very basic ultrasonography can detect or can identify the pregnant due date, the vitality, if there is a multiple pregnancy, fetal position, if there is any problem with the amniotic fluid, and if there is any problem of macrosomia. So the most common or important problems during a labor or during a pregnancy can be identified previously with this very simple system. The other, well, I will take later of the other problems, and the other part of the problem was the blood test. And well, like 4 years ago, we started with a solution that was based on dry blood that was collected in a special paper. And after drying it in the air at air temperature, we put it in an envelope and we carry it to the laboratory. And 3 weeks later, in the laboratory, they can recompose this blood and do an analysis similar to the one, do tests similar to the one they do usually. PHE, syphilis, hepatitis, glucose, malaria, whatever. And to do urine test, you can use a very simple quick test or strip test that give you a measurement of nitrates, proteins, and leukocytes that let you analyze or evaluate the risk of preeclampsia and the risk of infections. Well, this dry blood system was the first version of our project. Now we are using strip tests for everything because now they are low cost and affordable in all these countries. So we are using, and then it has a very important advantage is that you have the result of the test immediately. So if it's on a screening, it's not definitely, you have, if the test is positive, you should send the woman to a hospital to do a second test, but it serves to do a screening and to identify potential emergencies. Well, sounds very good, but it lacks one important thing I have already said, is the training part. Well, for the training part or the personnel able to do this test. And what we have done is to train nurses that usually visit these communities once a month. And we have trained them to do this very basic ultrasound scan. It's not a complete scan, but they manage to identify if the head is up or down, if they have placenta previa, if they have twins. The most important things can be identified with a training on some days. So we have trained a group of nurses. And well, our problem is that the battery of the laptop only serves 2 hours or something like that. No? So we have integrated as part of the solution is this photograph is very bad, but it's a foldable solar panel that has the size of the laptop also, and it's not very heavy. And we use external batteries. So with the panel, we charge the battery, and with the battery, we can charge power the laptop. So these systems can run for weeks in isolated communities without access to electricity. And everything can be packed in a backpack, like this one or like this one, and be carried out for around the rural areas of Guatemala or other countries. So, well, I think I'm taking too much time. I would like also to talk, I'm gonna do a very brief summary of the challenges, because when we talk about all this, it sounds very well, it sounds very perfect. And when you go to the field and you start to do this, you found all the problems in the world. And some problems are technical. You suddenly discover that the laptops you have bought are not good enough for this kind of probes, or that this cable is very sensible and at the end of the month it is broken and it doesn't work anymore. And but identify this problem takes a while when you are far away. Besides the changing the processes inside a public health system takes time. The nurses are not used to use ultrasounds, and this means some extra work for them. So they are willing on one side, but it's an extra work, and that's not good for anyone. So you have to manage that also. Sometimes the suppliers have a stock out of a strip test, and you don't have tests you don't have strips to do the test. The government suddenly decides to change the whole health system, and that has 1 year ago this was the case, and all the people you have trained to do this kind of tests suddenly is out of the system, and you have another new group of people that works in a different way because the whole system has changed, and you have to train them, and some have to work with them with the new structure of the system. And this year they are going to change again some of them because another government has arrived and they have decided to change another things. And in the meantime, some of this personnel have not been paying for months because there is an economical crisis in Guatemala. So it's like each week is a new adventure. So we can call this healthy pregnancy challenges, or healthy pregnancy headache, because it's really complicated and it's hard to explain this here in Oporto in a very warm room. It's really hard, no? In fact, I was talking this morning with Pedro about a film, A Perfect Day, that talks about the experience of some guys in the war of Yugoslavia, and they work for an NGO and they try to provide clean water to a community. You know? And well, the film starts when they need a rope, and they live a lot of adventures trying to find a rope. And you can think, if you see the film, you can think that it's stupid or that it is exaggerated or something, but it is very, very real. And I think that, well, other aspects of the film can be discussed, but the thing of the rope is absolutely real, and can be a rope and can be a screw or can be whatever, a small cable. But in certain contexts and rural area of developing countries are very special, this is a very big problem. So, well, we have to face a lot of problems, also cultural differences. Well, this could be a very long discussion also. But well, the thing is, I have already said, there are very complex scenarios. So we usually need to face them with a partnership between different actors. No? Well, after 1 year or almost 2 years of work, with three ultra probes like this, we managed to attend 1,000 pregnant women. And we had a control group of another 700 women. And in the intervention group, maternal deaths were 0. In the control group were 5. The natal deaths in the intervention group was 18. In the control group were 49. So the statistics are relevant. The only problem is that the sample is not big enough to be really significant, statistically significant. But we have been working on that. Now we have attended 4,000 women in the last year. So it's a big step forward. And we expect to confirm these results. I think that these results are not definitive, but they show a trend. And well, this paragraph of here shows that there is a culture or a more complex problem. You can identify the problem, but if the woman don't want to go to the hospital or can't go to the hospital, then everything can be not useful. So, well, there are still some things that can be improved, a lot of things, but we are working on that. And well, one other important thing that I have forgot is that we have developed a platform for training. Let's see if this works. Well, now it's not working. Yeah. This is the platform where we have materials based on text, but also in videos to show the nurses how to perform an ecography, how to identify the problems that you can have, and these kind of things. But well, we don't have too much time, I think. And this is part also of the work that we have done in this project, trying to reinforce that training part. I don't know why it is not working, but. And we have also used a health information system to collect all the information in the same laptop and to synchronize it to a common server. And this information is later reviewed by a specialist to confirm that the diagnosis and the treatment that the nurse has decided is good enough for the case that is working with. And well, the next step for us is to, in other countries where they have enough money to pay for this kind of services, but they lack the political and institutional infrastructure to do so, like Peru, we are trying to develop a social company that will offer this service to the health system, and that should cover it, because for example, in Peru, the ultrasound scans for the pregnant woman are covered by the health system, at least for the people with less resources. So we are working with the health insurance system in Peru to try to find a public-private partnership to develop this idea in Peru. And well, I think that this is also a summary of what I have already said. And well, we are also working now in Equatorial Guinea, so the project is being scaled to other countries. In Guatemala, we have reached other departments. So I think a lot of international agencies are very interested in this project. So we are trying to use or to expand it to other areas. We want this kind of solutions to be applied. We are not like friends of patents or something like that. We want this kind of solutions to be copied and to be used in other scenarios. We try to bring them to the places where we can, but if other institutions are able to spread this in other areas, we are happy to collaborate with them. And well, are also a lot of future work that we could do. We have a very big or quite big database of images and with its labels and with diagnosis and with everything. So we could work with this database. We can improve the methodology to train the nurses. We can add functionalities to the software. I think so we can do a lot of work to improve the solution. We are on the road. And well, here you have also some references of the information I have provided and the projects I have been talking about. And that's all that I wanted to share with you this afternoon. Thank you.
So questions? Questions, comments?
So you didn't mention, but you mentioned during our talks today that you spend more or less half of the year in Latin America, in jungles some of the times and everything. So my question related with this, normally you go there for when starting the projects. What are the initial difficulties or problems that you usually face when trying to implement something that was already, I think, planned ahead? In this case, either from Spain or whatever, depending on how the project evolves. In this case, you are involved also in European projects, so they are mainly planned and then they are, let's say, implemented in some of the countries, either Peru, Guatemala. What usually are the primary factors that have blocking factors or whatever that are difficulties when on the ground?
Well, we always work with local partners, so in some way the design is quite, or we try to adapt it as much as possible to the specific scenario. But the first step is always to talk with the health ministry, health system, with the public institutions, and there we found usually very willing people willing to work with us to collaborate, but the bureaucracy is still slow. And starting with this kind of project requires some time and some meetings and some discussions, and also something that can be very simple here, but getting the equipment from USA to Guatemala, Peru, can be a very difficult process depending on the kind of the equipment and the country and everything. So it can take a lot of time. Finding the people who's gonna be trying it usually requires a lot of time. Training the people, starting the project and making it like go fluent requires a lot of time, a lot of effort, because you have to change a lot of things in the process. No? The public institutions, the people who work in the project. So I don't know. There are a lot of things that you have to take into account.
One thing that is usually brought up, and it's regarding the training that you mentioned. So, for example, you said that you need to provide training, and then these facilitators, the community facilitators, how are they certificated? Meaning, they have to have a specific training for, they do to have the training prior to being on the ground, of course. And what is the certificate or the certification that they have to achieve? I say this related also with the things with the digital, that while doing the first exam, right? So they are, let's say, training and being certificated in some way. So it depends then on the country, on the rules of the country, and how to certificate them for, in this case, auscultation, or in other cases, like community facilitators do. So what I was trying to get at is, so what is this process of training? What does it encompass? What are the restrictions or rules that you need to abide for the country for them to be, for example, community facilitators?
Yes, for the case of the community facilitators, they have a training of approximately 1 year that has been previously defined, because the innovation was to insert the cell phone. So they already had a training defined by the ministry, and the ministry was paying them as very small salary, but salary, no? So that was like something that we didn't work on that, and Tura Salud didn't work on that. Then when you, in the case of, for example, healthy pregnancy, that is more tricky. The way we have solved it is, okay, we work with them, and the instructor is the person who decides if they are able to start to work by themselves. And to solve the legal issues, we have specialists that review all the cases and in some way certificates that they are being correctly managed. So all the information that we get in the health information system is later reviewed by a specialist, and in this way we managed to solve the legal issue, because it's true that a nurse shouldn't be doing this kind of test.
Other questions. So if you want, you just need to interrupt me.
So I don't know. So another thing that you mentioned briefly on one of the slides, but during our talks again, and what you mentioned also when we had the talk last year, was the collaboration regarding some telecom operators. So could you tell us a bit more? I already know, but for the benefit of the audience, a bit more, how does it work? What does it entail when you have this cooperation? What is the benefit for provider, in this case of the telecom provider, and for the project itself?
Well, we have been talking this morning about a different project that is also innovative, but more related specifically with communications. And I have already said that we use communication at the start point. No? We try to find a way to provide communication to an area, and after that, we try to think on telemedicine projects. Working with the operator allows us to make the network sustainable. The problem, we know how to deploy networks with different technologies. We have been deploying networks using Wi-Fi or WiMAX for a lot of years, and they are reasonable low-cost networks that in the long term are more economic than satellite solutions, and but the problem with this kind of networks are that who is responsible for maintaining them. After deploying them, we have transferred them to the local government, but most of the times the local governments sometimes are not willing to pay for this, even if this is not much money. And so other times this is a problem of legal issues because they don't have too much money to maintenance. They can buy things, but they cannot repair them. It's something a little bit odd, but in some countries they have this problem. So finding a company that wants to keep this network operating because they are offering a service on this network or using this network is now the solution we have found to make the network sustainable. So the operator can use the network to offer 3G services in this specific case of Peru, and we can use the same network to offer telemedicine services. It's a win-win solution, and also the population are demanding the communication services because for them it's also very important. They want to talk with their relatives that are usually in the city or most of the time in the city. They want to be able to get information from out of their community, to know if the prices of the food are increasing or decreasing, to know if it's gonna have, for example, floods or some environmental problem. So they want to have access to information, and this kind of projects can help also in that line. So we think that is a good solution, and governments in Latin America are working also to support or to expand the coverage of cellular networks. So, well, that's our experience.
Just one last question,
We're a bit over the time also. Are you? Yeah?
Because all questions too.
Oh, can I?
Yes.
I can ask after.
No, I don't.
Thank you. Well, this is more of an excuse to say congratulations. I'm very sorry that I missed half the talk. I was in an event before. Wow, very impressive. We are very interested in the highly portable medical equipment. So I was so curious when you showed the ultrasound probe, and we work. We have a long-run partnership with Brazil, with Northeast Brazil, working with these mostly on auscultation, but they also use ultrasound for fetal and neonatal screening. But they use bigger machines. But ultrasound is getting more and more miniature, smaller and smaller, highly portable. So given all this accumulated experience, what do you think about the state of the art of this type of highly portable ultrasound? I mean, you clearly show that, well, there's no statistical relevance, but there will be probably. I mean, we all trust that. Do you think that the quality of the probe is a very strong influence on that performance? Or do you think that for this type of screening, technology is already quite interesting if it's this small and so portable? What are your thoughts on this?
Yes, no, I think that for this kind of screening, that's the point. This is enough. But yes, if you want to do more specific things, more professional things, then you need a more powerful ultrasound system. So this is very useful for this kind of projects, for screening, but yes, the images quality is not good enough for other kind of things. So you have to identify which is the needs in the specific application.
I was just a comment. It's very interesting. I think it's probably in your papers, etc. You know what kind of, you know, if we think all the percentage of problems that can happen during you know, pregnancy, you know, maybe these, if current technology covers 80%, that's a very strong number. Current highly portable technology, and I think that's something that the international community must be aware about. The higher quality and the usefulness. Sometimes in Europe and the US, we have, you know, other conditions, so we tend to disregard this. But as soon as we work with South America, like we do, you understand that this might play a key role there.
So it's very interesting.
Yes, and governments and institutions in Latin America and in other countries are very interested in this kind of solutions. So I think it's the near future for facing these challenges.
So I was just going to finish with a, let's say, more general questions in terms of, given that you have all this work going back and forth, from what is the most rewarding aspect of all this job? So it's a very generic question to end up more or less in a difficult one perhaps, but is it, so it has a challenge, meaning the difficulty of the challenge, it has the rewarding of improving healthcare in other parts of, in this case, developing countries. So what is the drive? What is?
Well,
Yeah,
it's a difficult one. The first answer is in INEAS we have one statement, and that is that our mission is to disappear. So I think that the best thing that could happen is that no one will have to go to these countries to do more projects of this kind. If we solve the problem, it's the better. So I think it's something that needs to be done, and so that's some even responsibility I think we have. I like to travel. I like to meet people. I like to, part of my job, I like to do research, to innovate, to find solutions to all problems. But I'm aware that we are facing a problem. So I would prefer to do other kind of challenges, no, and less vital or less. Because, well, you also face it in cases where you say, well, the problem is very big, no? And this morning I also told you about finding a girl of 14 years old that was in 6 months had get pregnant, get an abortion, get pregnant again, get an abortion again, and get pregnant again. And the mother said she thinks she's still a child. Yes, she is a child and she plays like a child, and the abortions are probably related with jumping and playing and running and everything. That is what she should be doing. And there are, in this case, it's related with gender issues that are very big to this project and big for most of the projects, but that we should address also. No? So we also feel that the challenge is too much big, and well, we try to do a small job to solve it, but I really would prefer to focus on other kind of problems.
Thank you.
Thank you.